Interprofessional Education Assignment 1. Today's date, July 18th, 2016. Jonathan Hoagland, and I will be reporting case number 2 to an ophthalmologist for referral. Good evening, Dr. Kiesling. This is John Hoagland. I'm calling you tonight to refer a patient to you. The patient is 24-year-old, white male. He has given me permission to release both his name and his medical information to you. And we will be contacting your staff to schedule his appointment in the coming few days. Mr. Brown reported to me he's got Blue Cross Blue Shield Insurance of Tennessee. He reported complaining of pain in his left eye as well as blurry vision at both distance and near. The OD also had light sensitivity, but other than that, he seemed healthy. I noticed immediately bruising around his left eye and could see that he had sustained trauma. There was also bleeding into the anterior chamber, producing a hyphema that took up the bottom third of the patient's left anterior chamber. As far as ocular history for this patient is myopic but only wears glasses for driving. The patient's medical history is unremarkable, as well as family medical history. The patient's family ocular history is positive for cataracts and glaucoma. Once I began testing, his visual acuities in the left eye were very poor, 2400, with no improvement for the pinhole. So I knew that the hyphema here was obviously giving the patient some trouble. OD was normal visual acuities, no problem seen there. So the damage to this patient was obviously from this injury that he had sustained to his left eye. Patient reported in case history that this was a soccer ball accident. Upon further testing, the patient demonstrated pain during ocular motilities, and the pursuits were jerky, caused by the left eye from trauma and some of the adnexa swelling from the injury sustained. Left pupil was also blown. The pupil was 7 millimeters and light response was reduced. Light response was only to 6 millimeters due to some of the blockage of the blood or other neurological complications with the injury this patient sustained. With the complete ocular assessment, I noticed that there was some ecmosis or bruising in the adnexa around the eye, obviously sustained from this traumatic injury. Conjunctiva was 2+ injection with a subconjunctival heme in the left eye. The iris was seemed intact, but I was unable to view the inferior attachment of the iris root, obviously due to the bleeding into the anterior chamber. Poor visibility of the pupil and poor visibility of the angle also has complications of the hyphema. The IOP in the left eye was elevated significantly at 35 millimeters of mercury, and so that's definitely a concern of mine, definitely looking at preserving the vision that this patient will retain after the bleeding subsides, and just trying to ensure that there's no other neurological damage in that left eye while the hyphema dissipates. I was unable to get a full view of either the anterior chamber or the posterior of the eye due to this hyphema. Diagnosis for this patient was hyphema resulting from the traumatic injury. We saw the bottom third of the anterior chamber was filled with blood. So potential complications that I foresee with this injury would include secondary hemorrhages in other areas of the eye as well as secondary glaucoma. So we just wanted to get this patient in and get him referred to you so that we can continue to maintain healthy vision for this patient following through the treatment and progression of this hyphema. Thank you and have a pleasant evening.